Over time, we lose volume in our earlobes, and that can lead to stretched earlobes or earlobes that no longer hold an earring very well. Also, over time and with trauma, the ear ring hole itself can become stretched and stretched so much that it's barely holding an earring. Or with trauma, it can actually tear all the way through. So, the things that we offer for repair of these earlobes include surgical repair and dermal filler. Dermal filler is the injection of a skin filler into the earlobe to restore the structure and help it be stronger so you can wear an earring. I think this is critical, and I recommend this a lot because I think a deflated, flappy earlobe does give away your age. And so I often will recommend that we put a little filler in there. And it can be rewarding if you wear earrings because it helps you wear your earring better. If the earlobe, the earring hole, has actually gotten so large that you see air through it when you wear an earring, or it's just hanging on by a thread, or it's completely torn through, then we need surgical repair where we create a new earlobe for you via removing the old earring hole and suturing it up. The stitches stay in for about a week, and then somewhere around about 10 or 12 weeks you can have your ear re-pierced. So there are solutions for a damaged ear or an aged earlobe.